Jesteśmy zespołem terapeutów DBT
i opowiadamy o terapii dialektyczno-behawioralnej
z myślą o osobach doświadczających dysregulacji emocjonalnej,
a także ich bliskich, terapeutach i wszystkich, którzy chcą nas posłuchać.
Robimy ten podcast, bo wiemy, że terapia DBT jest skuteczna
i pomaga w zbudowaniu życia wartego przeżycia.
Jeśli uważasz, że to, co robimy, ma sens,
możesz nas wesprzeć za pośrednictwem serwisu Patronite.
www.patronite.pl/kurs na DBT.
No to co? Jedziemy! W połowie października 2023 roku byłyśmy z Gabrysią na szkoleniu w terapii DBT Zaburzeń Odżywiania, które to szkolenie było prowadzone przez doktora Fragiskosa Gonidakisa z Uniwersytetu Ateńskiego w Grecji. I miałyśmy takie super szczęście, że dzięki spontaniczności Gabrysi udało nam się nagrać z nim krótki wywiad. Więc teraz Was na niego zapraszamy. Ale powiem jeszcze, żebyście wiedzieli, kim jest dr Fragiskos Gonidakis. Jest lekarzem psychiatrą, doktorem nauk medycznych, adiunktem psychiatrii w Szkole Medycznej Uniwersytetu w Atenach. Jest też kierownikiem pododdziału Leczenia Zaburzeń Odżywiania oraz programu dialektycznej terapii behawioralnej, funkcjonujących w ramach oddziału psychiatrycznego w Szpitalu Uniwersyteckim w Atenach. Ten wywiad nagrywaliśmy w krótkiej lunchowej przerwie, w sali, do której ciągle ktoś wchodził, więc bardzo Was z Gabrysią prosimy o życzliwy odsłuch. I zastanawiałyśmy się, miałyśmy 15 minut na rozmowę, jakie pytania zadać. Poprosiłyśmy Was, naszych słuchaczy i naszych pacjentów o to, żeby te pytania pochodziły od nich, od Was. I takie właśnie są. Rozmowa jest w języku angielskim, więc tych z Was, którzy nie posługują się płynnie angielskim, odsyłam na YouTube. Tam jest taka możliwość, żeby włączyć sobie automatyczne tłumaczenie w formie napisów. Ono powinno być wystarczająco dobre, więc włączcie YouTube'a, ci, którzy potrzebują tłumaczenia. I zainspirowana tym szkoleniem, które było fantastyczne, chciałabym nagrać Wam też krótkie ćwiczenie, którego nauczył mnie dr Fragiskos, uważności jedzenia. On mówi o tym, że w leczeniu zaburzeń odżywiania są dwie kluczowe umiejętności debetowe. Pierwszą z nich jest właśnie uważność jedzenia, czyli uważne, świadome jedzenie. Drugą jest surfowanie po impulsach. Do surfowania po impulsach link wrzucam w opis, a uważność jedzenia nagram za chwilę. Zapraszam na wywiad. Thank you very much that you accepted our invitation and we can speak a little. Well, we were thinking about questions and we asked our patients and our listeners, so we have questions from them.
Okay.
Let me say that our training is about DBT and eating disorders.
Yeah.
So maybe let me start. First question from my patient. What is the line, where is the line between snacking and binge eating? What is the difference?
Well, it has to do with observing the whole meal plan. So if I have distinct meals that are set apart every 2 hours, this is probably eating normally and having 2 or 3 snacks every day. But if I have the need of eating something every half an hour or 20 minutes, then I'm probably binging.
Okay. And when I can say that it is too much, I mean that it is problematic behavior, not just me having eaten another sweet thing.
You can measure how many calories you consume every day and what is your caloric expenditure, because a person that is doing weightlifting and has a very increased muscle system, it probably needs more than 2,000 calories per day. This is the first one. The second one is how do I react if I don't find the food that I want? Am I going to be very annoyed? Am I going to stop working? Is my mind going to be fixated on that? Then this is probably I'm experiencing a withdrawal syndrome, and this is probably a problematic behavior. It has to do also with how much time do I spend by searching food, thinking about food, preparing my next meal. Does it distract me from my work? Does it create a problem with my social life, with my family? Then probably I am facing with an eating disorder.
What about feeling of guilt? Is it important here?
Well, guilt is important, and it is one of the diagnostic criteria of binge eating. But people also feel guilty, and the guilt is not justified in many occasions, like when somebody has a celebration and offers some sweets in the office, and you eat one sweet, you can feel guilty because you are programmed in your mind to think that you have to follow a very strict dietary plan, and you have actually sinned against this plan and eaten something that was not in your plan. So at this point, I think that guilt is not justified, but if I eat a lot of food without being able to stop, and then I feel guilty, then probably I'm suffering from some kind of binge eating disorder.
Okay, thank you.
Okay. I have another question. I'm sure there is no easy answer for that, but do you have, or what is the alternative to use the mindfulness and stop skill during the binge eating episode?
I don't think that during a binge eating episode you can actually use any kind of skill, because it's like sliding down a slope. You are going to stop at some point, but it is a point that the brain is saturated and it doesn't need any more food. We can use the stop skills or mindful eating or some of the mindful skills before the binge eating episode. And sometimes a very few of our patients can stop the binge eating episode later when the urge has subsided, but not at the moment where the emotions are escalated and you get into the behavior. It's very difficult to stop the behavior, and we don't ask our clients to do something like that because it's they will probably fail, and then they will feel guilt that they failed and they couldn't stop the binge episode.
So could you please name a few skills, DBT skills, which are helpful the most when I feel urge to do binge eating?
It's the binge eating comes out of two sources. One source is hunger. So you first start with observing mindfully what you are eating and how much you are eating, because you have to cover all the dietary needs every day. So if you are hungry, you are actually will not be able to stop the binges, because binging out of hunger is can also be regarded as a normal behavior. It's like drinking a lot of water if you feel very thirsty. It's very difficult to say that you need to drink very slowly, just a small cup of water. If you are extremely thirsty, you are going to throw yourself into the water. If you are not hungry and you have managed your dietary plan, then the next thing is to try to train yourself to observe your urges, understand them, knowing where they are coming from, what emotions are actually creating these kind of urges, and then train yourself to serve the urge, restrain the urge, observe the urge until the urge goes down. But in order to do that, you need to first be certain that you are not hungry, because if you are hungry, the urge is not going to go down, because it's not an emotional urge, it's a biological urge, and it will continue to press you until you actually find some food. And then you'll probably have a binge episode.
How do I know that I'm not hungry anymore. That now I could stop eating because I fulfilled my hunger. And how do I know this?
Okay. That has to do with mindful eating, because when we pay attention to eating and we are doing only that and not watching some YouTube video or surfing the internet or calling and texting to our friends, then at first I observe the hunger. The hunger is the bus that will take me to the food source. So the hunger urges us to try and find food. And after a few bites, the hunger goes down, but we do not feel saturated. And then we continue to eat. And if I eat mindfully and I remain in the present and I receive all these pleasant sensations from the food, the smell, the taste, and the visual image of the food, then after a while I will feel that I am saturated and I don't want to eat anymore. And this is the moment that I can stop.
Okay. So you named three skills: knowing, fulfilling the hunger first, yeah.
Yes.
Yeah, and then surfing on the urges,
Okay.
and then mindful eating.
Yes. So it's taking care of the body is an emotional regulation skill. Surfing the urge is a distress tolerance skill, and being mindful of what I'm eating is, of course, a mindfulness skill.
Okay, thank you very much.
Yeah, I have a last question. How do you work with regaining of real body image?
Body image is very difficult to treat in eating disorders, so there is no effective solution to that. So in eating disorder psychotherapy, I mean eating disorder behavioral psychotherapy like CBT or DBT, we use exercises in front of the mirror. We use exercises with images of the body, photographs of the body, and we'll try to work through acceptance of the body, whatever dimensions it has, and feeling validated and valuable beyond your weight and the measures of your body, but we still have not found a very effective way to deal with body image distortion, meaning that some of our clients that are suffering from anorexia nervosa, they keep on experiencing a body that it is in their mind far more bigger than it is in reality, and that creates a lot of stress, and it keeps up with the need to reduce the food and get back to starvation, because it's very difficult to tolerate a fat body while at the same point you are actually having a normal body, a very slim and normal body. And usually body image is restored when the nutrition and the weight is restored, but in some of the cases this is not happening, and this is a factor that contributes to relapses of anorexia nervosa. But we don't have a very effective way to change that.
Okay.
And
So-
usually it takes a lot of time. It takes years for the body image to start changing and come back to what the body really is at that point.
So, does we sometimes need to radically accept that my body image for a long time will be changed?
At some point, they have to radically accept that I am, in order to be healthy and actually do the things that I would like to do in my life, I have to accept that I will feel more fat than I'm actually are. And this is going to change over time, but it's going to take a lot of time.
Okay.
which is very difficult bite to chew, if I might say so.
Yeah.
Okay. Thank you very much, Fragiskos.
You're welcome.
Thanks a lot that we could speak to you. Thank you.
Nie każdemu udaje się dotrzeć do końca odcinka.
Cieszymy się, że dopłynęliście tu razem z nami.
Jeśli uważasz, że to, co robimy, ma sens,
Możesz nas wesprzeć za pośrednictwem serwisu Patronite.
www.patronite.pl/kurs na DBT.
Wdzięcznie spożytkujemy każdą przekazaną nam wpłatę.
Stwórzmy razem ogólnopolską debetową społeczność.
Do usłyszenia w kolejnym odcinku.